If your gums bleed when you brush your teeth, what do? Most people rinse, spit, and move on. Maybe switch to a softer brush, maybe just ignore it entirely. And that reaction is so common, it feels normal. But from a biological perspective, that small detail, that moment of bleeding, may be one of the clearest visible signs of inflammation in your body. Not something dramatic, not something painful, but something real. In the last episode, we talked about how the mouth can be sick in silence, how disease can progress without pain. Today, I want to take that idea one step further, because there is one place in your mouth that does speak, clearly, visibly, every day. Your gums. They change color, they change texture, they bleed, they recede. And every one of those changes carries information, not just about what's happening locally, but potentially about what's happening in your body as a whole. This episode is about learning to read those signals. Welcome to the Dental Longevity Show. I'm Dr. Mario Parra. Let me start with something most people have never been shown. What does a healthy gum actually look like? A healthy gum has a pale pink or coral color. Its surface has a subtle texture, small stippling, almost like the skin of an orange, which indicates that the connective tissue underneath is well organized. The margin, where the gum meets the tooth, is thin and firm. It fits tightly against the enamel. It doesn't bleed when touched or brushed. Now compare that to an inflamed gum. The color shifts to red, sometimes dark red or even purple. The texture becomes smooth and swollen. The margin is rounded, puffy, and it bleeds, sometimes spontaneously, sometimes with the lightest contact. But here is the key insight, and the one that changes everything. A healthy gum is not just about how it looks. It represents a state of balance between bacteria, immune response, and tissue integrity. When your gum is pink, firm, and quiet, it means that your immune system and your oral microbiome are in equilibrium. Nothing is winning, nothing is losing. When that balance breaks, the first thing that changes is what you can see. And what you're seeing is inflammation. The problem? Most people have never seen a healthy gum in context. They have no reference point. Without a reference, you can't detect the change. Let me be clear about something. Gingival bleeding is not because you brush too hard. That is one of the most widespread misconceptions in oral health. In the vast majority of cases, bleeding gums indicate active inflammation of the gingival tissue, a condition known as gingivitis. And gingivitis is not a cosmetic issue. It is the body's immune response to a bacterial challenge that has exceeded a certain threshold. Now, here is where it gets more interesting. For a long time, gum disease was considered a strictly local problem, something that happened in your mouth and stayed in your mouth. But over the past 2 decades, a growing body of research has explored the relationship between periodontal inflammation and systemic inflammatory markers. A study published in Diagnostics in 2023 compared blood levels of C-reactive protein, one of the most widely used markers of inflammation in medicine, between people with chronic periodontitis and periodontally healthy individuals. The results were clear. Patients with active gum disease had significantly higher levels of this inflammatory marker in their blood. But here is the part that matters most. After receiving non-surgical periodontal treatment, essentially a professional deep cleaning, those levels dropped significantly. The inflammation in the gums went down, and the inflammation measurable in the blood went down with it. What does this mean? It means that what looks like a local problem in your gums may be reflected as a measurable inflammatory response in your blood. We need to be careful here. Association does not mean causation, but the direction is consistent across multiple studies. Chronic gingival inflammation is not isolated. It participates in the body's broader inflammatory landscape, and chronic inflammation even at low levels, is something that modern health science associates increasingly with long-term biological processes. Not because it causes one specific disease, but because sustained inflammatory activity may influence how the body ages, heals, and maintains stability over time. That bleeding you ignored this morning, it may be worth paying attention to. There is another signal your gums give, one that is slower, quieter, and often irreversible. Gingival recession. Recession is when the gum tissue pulls away from the tooth, exposing the root surface underneath. Many people notice it as teeth looking longer or feeling more sensitive to cold. Most assume it's just aging, but recession is far more than a cosmetic concern. A systematic review and meta-analysis published in the Journal of Dentistry in 2025, one of the most comprehensive to date, estimated that the prevalence of gingival recession of at least 1 millimeter was approximately 81% in the general population. That's not a rare finding. It's one of the most common oral conditions in the world. The same review identified multiple risk factors. Periodontitis was the strongest, with an odds ratio of nearly 10. Dental plaque, smoking, alcohol consumption, trauma from occlusion, and even certain anatomical features, like a high frenulum attachment, were all significantly associated. But here is the reframe I want you to take away from this. Gum recession is not just tissue loss. It's a record of what has been happening over time. What you see today may reflect years of mechanical stress, chronic inflammation, and biological adaptation. It is your gum's way of telling you its history, a history of forces, habits, and processes that have been acting quietly, often without symptoms. And in many cases, once recession has occurred, it doesn't reverse on its own. The tissue doesn't grow back, which is why it's such a valuable clinical signal. It reflects what has already happened, and it gives you context about where things may be heading if nothing changes. Recession is not something to dismiss as cosmetic. It's information worth paying attention to. Your gums don't just show signs, they produce biological information. Most people have never heard of gingival crevicular fluid, GCF for short. It is a fluid that comes from the small space between your gum and your tooth, known as the gingival sulcus, and it contains far more than you might expect. A systematic review, published in Biomed Research International in 2024, examined the diagnostic potential of this fluid and identified a wide range of biomolecules present in GCF, including cytokines, metalloproteinases, bacterial DNA, and immune-related proteins. These molecules don't just reflect what is happening in the gum tissue. Some of them may offer insight into processes occurring beyond the oral cavity. The concept is remarkable. A fluid your body produces naturally from a tissue you can see and access, carrying molecules involved in inflammation and immune response. And the broader picture is consistent with this. A global meta-analysis published in Oral Diseases estimated that more than 2/3 of the world's population has some degree of gingival recession, suggesting that changes in gingival tissue are among the most widespread and least addressed conditions in oral health. When we talk about longevity, we are not just talking about lifespan. We are talking about maintaining biological stability over time, the ability of your body to repair, regulate, and adapt as the years pass. And one of the key factors in that process is how your body manages inflammation. Most people think about inflammation as something acute, pain, swelling, an injury that heals and goes away. But a significant part of modern health science is focused on something different: low-grade, chronic inflammatory processes that don't always produce obvious symptoms. They accumulate, they persist, and over time, they may influence how your tissues age, how your immune system responds, and how resilient your body remains. And this is where your gums become genuinely interesting from a longevity perspective. because they may be one of the very few places in the human body where you can actually observe chronic inflammation happening in real time, without blood tests, without imaging, and without any technology at all. You look, you observe, and you notice a change in color, a swelling, a tendency to bleed. And what you are seeing is not just a dental issue, it is your body's inflammatory response made visible. The preventive mindset begins with paying attention to what is already in front of you. And few things are more in front of you, more accessible, more visible, more immediate than your gums. Most people wait for pain, but your gums don't wait. Your gums have been responding for a long time, changing color, shifting position, bleeding, producing signals that reflect what is happening, not just in the mouth, but potentially in the body. The absence of pain is not a diagnosis, and in many cases, what matters most is already happening before you feel anything. The question is not whether your mouth is speaking, it's whether you know how to listen. Next episode, saliva. What it does, why it matters, and what happens when it's not there. I'm Dr. Mario Parra. Thanks for watching. Pay attention. Your body already is.